Healthcare systems across the country are stretched thin, especially in California. Officials there are coming up with emergency plans to ration care. Carter Evans reports from Los Angeles.
Still a little short of breath?
Life at the epicenter. Los Angeles County under strict stay-at-home orders, with daily deaths up 600%, new COVID cases up nearly 1,000% since November.
Patients are being cared for and treated in the ambulances as if it's part of the emergency room. As bad as it is, the worst is almost certainly yet to come.
We're a 131-bed hospital that started the day with 224 patients.
With its gift shop and chapel now filled with hospital beds, Martin Luther King Jr. Medical Center is in full-scale crisis mode.
How does that look at this hospital?
Rationing care among all hospitals looks very much like what happens on a battlefield during a war.
Another Southern California hospital is also preparing an emergency plan for rationing care, insisting it will not put the burden on frontline workers. Instead, a committee that includes doctors, a bioethicist, and a spiritual care provider will decide who gets potentially life-saving treatment. L.A. County is now requiring anyone traveling here to quarantine for at least 10 days. And the county's also urging Hollywood studios to hit pause on productions. Nationwide, back-to-back holiday gatherings are leading to record-breaking surges, with New Year's Eve just 2 days away.
Which could make January even worse than December. I hope not.
In Holyoke, Massachusetts, joy amid the heartbreak inside the Soldiers' home where 77 residents have died from COVID. Today, the first vaccines were given. This area out here used to be the ambulance bay for the ER at MLK Hospital. Now that's a triage tent. There is another tent back there that's full of COVID patients waiting for a bed. Beds aren't the only thing that are full here right now. The morgue is too. So they've got a refrigerated truck out back with another on the way. Omar?
Carter Evans, thank you. For more, let's bring in Dr. Timothy Brewer. He's a professor of medicine and epidemiology at UCLA. Doctor, thanks for joining us. I want to start by talking about California. Governor Gavin Newsom says his state is expected to see a, quote, surge upon a surge, arguably on top of another surge. California had some relatively strict lockdowns. So what happened?
Terrific question. And the short answer is we don't know for sure, but probably a combination. One is we have, particularly in Los Angeles County, a lot of poverty, urban density, a lot of essential workers, and manufacturing. All of those are high-risk groups. We also have 10 months of dealing with this pandemic, and so fatigue is setting in. And finally, the cold weather also contributes to the spread of respiratory viruses, particularly as people move indoors.
California is expected to extend its stay-at-home order for areas that are running out of intensive care beds, and these facilities have been at or near capacity for weeks, as I'm sure you're aware. Can California handle the surge of cases? And if not, what do they do?
Well, you know, the challenges right now is not only space, but it's people, right? So not only can you have to find a space to put the patients, you need the doctors, the nurses, the respiratory technicians, everybody else involved in making a hospital run. And because the numbers are so high across the country, we can't really ask other states to help us out. So that's going to be a real challenge for us going forward. And we have to recommit ourselves to doing those preventive measures to try and get our case numbers down.
Let's talk brass tacks here. What's the state's best and worst case scenario in the coming weeks and months, especially knowing New Year's Eve is right around the corner?
So, I mean, in the best case scenario, over the last week, we've seen a little dip in cases and hospitalizations, both across the country as a whole and within California. So hopefully people will continue to recommit to wearing their masks when they're in public, staying home when they're sick, not going out if they don't have to, good hand hygiene. All those things we know that work. Worst case scenario is people go out over the holidays, they gather, they travel, they spread COVID, and we see numbers just continue to go through the roof.
What California is experiencing, Dr. Anthony Fauci says, the country should basically brace for as well. On Tuesday, he said he expects January to be worse than December because of the holidays and the holiday celebration. When might people start seeing the impact of vaccinations kind of pushing against that surge in cases?
So we may not see the impact of vaccination for months. Remember, one of the things we don't know is, does the vaccine actually prevent against infection and stop transmission? So we have good data to show that these vaccines prevent serious disease and hospitalizations, but we essentially have no data to suggest that they stop transmission. So we're not going to be able to rely on vaccines to get us out of this, certainly not in the next 6 months to a year.
The vaccine is not a get out of jail free card or a get out of the hospital free card. You still have to take your precautions. A World Health Organization official said on Tuesday, this pandemic is, quote, not necessarily the big one. Basically meaning we could face something more severe. And also that COVID-19 has served as somewhat of a wake-up call. You're a medical professional, you're on the front lines. What are some of the biggest lessons that the medical community is learning from this pandemic?
So the biggest lesson is really for the public and the government as a whole, and that is you cannot ignore public health. So you just can't wait till you're in a pandemic to then try and rebuild your public health system. And we're facing the problem of having ignored our public health systems both at a national and a state and county level for decades. We've underfunded them for decades, and you really can't do that because a pandemic is not when you want to try to be building your public health system.
Dr. Timothy Brewer, thank you very much for your time.
Thank you.